Sure. Well, thank you for the opportunity to join. I was born in India, and I was born in a small town in Maharashtra, and my parents had already emigrated to the United States in the late 1960s. My father came here to do his medical residency, but I was born in India and then quickly came back here to the United States. But have enjoyed the opportunity to really stay connected to India and then also represent the Indian American community in the work that I do.
And your father came with the same $8 in a bag.
Yeah, something like that. I think he said it was maybe closer to $7, but he did tell me a
$7.
funny story of
Yeah.
how when he had to call the hospital at which he was going to do his residency, someone told him to put a dime in the payphone, and he didn't know what a dime was. So one of the first questions he had to ask when he came to the United States was, "What's a dime?" But yeah, very classic story that you hear from many individuals who took the bold step to come here. Clearly in the late 1960s and probably throughout the 1900s, heavily focused on healthcare. But as we've seen, the story is a common one now across multiple industries and multiple sectors.
And which city he settled in finally? How was his?
Yeah, so the initial city was in Chicago, Illinois. And then I grew up in the Midwest and a lot of opportunity to experience life in Michigan, Ohio, Illinois. But Ohio is where I spent the bulk of my time.
And when your childhood was spent in Ohio, which city?
Yes. Yeah, I grew up in Ohio and then did my medical school and undergraduate in Ohio as well, and then relocated to North Carolina in the early 2000s.
Wonderful. And how has been your experience in North Carolina?
North Carolina is great. It is a wonderful state in which to live. I feel very lucky to represent the healthcare sector here in North Carolina, doing what I do as secretary. We're a large state geographically. We're a large state from a population perspective. So it has a diversity of experience, everything from the mountains to the beach, big cities, small cities, and we often joke that in North Carolina you get to experience all four seasons, and sometimes it might even be on the same day. This has been a remarkable opportunity. When I was aware that Governor Stein might be looking for somebody to serve as secretary for the North Carolina Department of Health and Human Services, I was excited to submit my name. And as I mentioned earlier, I was very lucky to be accepted or appointed to the role. In North Carolina, the governor makes the appointment, but then the Senate has to go through a confirmation process, not unlike what you might see on the federal level. So I went through a confirmation process in March of last year and was unanimously confirmed, which was a real vote of confidence. And then since then have been focused on really a few key areas that are so important for the state, access and affordability. Medicaid expanded in North Carolina. We were the 41st state to expand Medicaid, and it's such an important part of creating access and sustainability for the healthcare ecosystem in North Carolina. So we expanded healthcare through Medicaid expansion to over 700,000 people in the state, which is a strong accomplishment. And to be fair, the work started before I took the job, but we continued that track record. The agency I'm responsible for is also responsible for the welfare of children, particularly children in the foster care system. And so over the course of the last 12 to 15 months, we've been spending a lot of time modernizing that system, creating a software platform that allows for counties to talk to one another electronically when they're sharing information about our most vulnerable children. And then, another big part of North Carolina is the ruralness of the state. We're a fairly rural state. In fact, only second to Texas. And people might not know that, but there's over 3 million of the 11 million people who live in North Carolina live in a rural community. So we were fortunate to be granted $213 million through the Rural Health Transformation Fund from the federal government to do some important work to really think about how we're going to create sustainability when it comes to healthcare in rural communities. So lots of focus on access, affordability, rurality, and making sure we take care of our most vulnerable citizens.
Wow, so you work a lot on accessibility part, right? Is the entire state covered? All the populations is covered, or still some parts
Yeah,
left?
yeah, there's always going to be access challenges. So much of access is dependent on whether or not you have insurance, which is why the Medicaid piece was so important. But because we are a big state and relatively rural, even in some areas when people do have insurance and they do have Medicaid, access is challenging because we see the rural hospitals have a hard time staying open because of economics. And some of the more, especially rural areas, you have a more difficult time finding a doctor, a healthcare provider. So we're looking at different ways in which we can create access and cover the state, as you mentioned, looking at the use of technology and telemedicine as a way to bring healthcare to those smaller communities where there might not be a doctor or there might not be a hospital, but you can still get the access that you need.
Wonderful. I was coming to the technology part anyway, but tell me about the affordability part. How you're working to bring the cost of healthcare affordable to the people of North Carolina.
Yeah, I really appreciate that question. Affordability is a challenge everywhere. And it's not just affordability because individuals may or may not have Medicaid for health insurance or another health insurance product. We're really looking at this idea of value. Healthcare is going to cost something. So how do we make sure we're getting the most for our healthcare dollar? So we're looking at ways we can use quality to help providers better understand what are the best practices in healthcare. How do we incentivize healthcare providers sometimes with a little bit more financial upside if they perform well from a value-based perspective? So that value element is really important for what we're trying to do. There's also an important piece that if you intervene early, you have a better opportunity to lower healthcare costs later on. So we've been looking at, again, the access challenges that we have and how we might be able to use that, but also focusing on this thing called social drivers of health. How do you look at individuals' access to things like food, nutrition services, transportation, and by addressing those needs, you actually end up decreasing more healthcare needs downstream. We had a project here that we're very proud of called the Healthy Opportunity Pilot, which demonstrated that if you invest in getting individuals behavioral health services, access to food, access to transportation, their healthcare costs actually go down over time. So in this whole idea of how do you bring affordability, it's early intervention is so important. And the story is no different in other parts of the United States and maybe in other parts of the world is early intervention is so important to making sure people get the best health care and you lower cost in the future.
Any specific thing projects that, as you mentioned, are launching or starting for as a preventive or early stage detection kind of thing?
Yeah, the what I mentioned earlier is that it's remarkable how important access to food and nutrition can be to improving healthcare outcomes as well as healthcare utilization. By having access to healthy food, you clearly make a difference with making sure people are fed and they get nutrition. But we also know that food-related issues, particularly hunger, can impact individuals and their use of healthcare. So we are very focused on this idea of how do we make sure that those who are the most vulnerable continue to get access to food and nutrition services, because not only that is that important for what it really does, which is feed people, but we know it has a impact on healthcare as well. Value of organic foods versus other foods. What we do know, though, is that pesticides and other chemical treatments to foods may have an impact on health. So I think there isn't conclusive evidence that organic necessarily is better, but intuitively you might say, the less exposure to chemicals, maybe the better. As it relates to certain foods and spices, the one we hear about most commonly is turmeric, and whether or not that has some benefit. Having grown up in an Indian household, there were always those stories of what to eat and what not to eat, what's good for your health and not good for your health. And I would say that I think some of those things that started out as more stories and maybe even best practices are finding themselves to be grounded in good medical science. And so some of the things that I think we often learned in an Indian household on the do's and do not do's are now actually being able to be proven with medical research.
Wonderful. So, what are the things that you're planning for the next part of your term, the remaining part of your term?
Yeah. There are a number of things we're focusing on here in North Carolina. One of them is to ensure that our Medicaid program continues to be a sustainable program. So we're really making sure that we're getting the maximum value for our Medicaid dollar. Making sure we ensure that there isn't any waste in the system either. So there's a big role for technology to better understand things like best practices or identify trends and expenses that don't make sense. So preserving Medicaid is so important. And it's not just because of Medicaid, but because it is such a part of the economic engine in North Carolina as well. By having a stable Medicaid program and all the other expenses related to it, it brings billions of dollars a year to the North Carolina economy. So healthcare, as it relates to Medicaid, is one area of focus. Still very focused on what we're trying to do to make sure that our rural population continues to have access to services. We're going to focus very heavily on the next couple of years around this affordability issue and how do we create affordability. So it's really continuing much of the work that we've already done. One of the things we're always responsible for is public safety. So we always want to make sure that as there are emerging illnesses out there and seasonal illnesses, that we're providing the best information to the people who live in North Carolina so they can make smart choices about their health.
Wonderful. Now, you mentioned about role of technology, right, in making healthcare accessible and affordable. Can you give us some insight into that?
Yeah, most definitely. I think we're just seeing the front end on the role that technology can play. And there are a number of ways I think we see that in healthcare. Most commonly, we see it in the life sciences and maybe in the device industry, where we're seeing just phenomenal technology that can now treat illness that maybe 15, 20 years ago was not survivable. So whether it's on the pharmaceutical side, what we're developing at the molecular level with technology, or on the device side, those innovations and breakthroughs are just remarkable. So that's a really exciting piece of it. They, at the same time, contribute to the overall expense of healthcare. So it's not disconnected from what I mentioned earlier, how important it is to focus on value when you're starting to have to pay for some of these more expensive, very appropriate emerging technologies. So that's one piece of technology. I think the other is in this efficiency space. There is considerable waste in the United States healthcare system on the administrative side. So, what can technology do to decrease administrative waste? And there's a role, I think, for AI to understand best practices. There's also a role for AI and other forms of technology to help with diagnosis and accuracy. And then finally, we're starting to hear about those things that make the actual delivery of care so much better. Everything from helping providers document to making sure individuals get to the right care at the right time, at the right place. So the technology front is really, I think, what's going to transform healthcare. The challenge is going to be, how do you continue to afford that? And we have to make sure that the best way that we have dollars available is to make sure they're really going to the most value that we can get for that dollar.
Tell me how much role the governor has in the state's.
Yeah, we have a great governor in North Carolina, Josh Stein. He had spent 8 years prior to becoming governor as Attorney General of the state, having focused very heavily on healthcare issues, things like the opioid crisis, issues related to access in hospitals. So he's come into his role with a tremendous amount of healthcare knowledge. Healthcare is part of his agenda as well. He wants to make North Carolina the healthiest and safest state in the country. So much of what we're trying to do is really focused on how to really make North Carolina as healthy as possible and as safe as possible.
Wonderful. Does he have any plans to travel to India?
We have talked, he and I have talked a number of times about the opportunity to learn so much about what's happening in India. And it's just not on the healthcare side. It's on the pharma side, which is, of course, healthcare related, but on the technology side as well. So I will continue to remind him to put India on his calendar.
Wonderful. Look forward to it. Yeah, I was over the weekend. I was in the North Carolina rally for the India Broad Dialogue. Sorry to miss you over there. But tell me, I saw a very vibrant community over there, very active and vibrant, energetic community. Tell me about the Indian Americans in North Carolina.
Yeah, you're exactly right. There is a incredibly vibrant Indian American community throughout the state, and so with Raleigh being the capital, we call that area the Triangle, part of the state, a very vibrant community. Some of it is supported by the incredible technology that we have and the technology presence that we have in North Carolina. So significant Indian investment in North Carolina as we think about biopharmaceuticals as well as in the technology space. And then we are a state that's blessed with a lot of institutions of higher learning where research takes place as well as education. And so you see a number of opportunities for the Indian American community to really embrace their background and their heritage while participating in all that's good about North Carolina.
Wonderful. A lot of people are trying to are moving to North Carolina, and in fact, I heard a number of them moving to from Indian literature. Tell me why they should be moving to North Carolina if they want.
Oh yeah, most definitely. So North Carolina, you're exactly right. It's a in-migration state, and by um, some measures, might be one of the most popular states to move into. And there are a lot of reasons why North Carolina is so popular, and it may be popular for the Indian American community. It does have, as we just talked about, a vibrant Indian American community, so you might be able to identify and find commonality with individuals who share the same background as you do. It has a huge technology infrastructure, as I mentioned earlier, so that gives an opportunity to think about where you might want to invest your time and energy. Great universities, fantastic weather, usually easy to get to many parts of the world as well. So it offers a lot of things, both in terms of just its natural beauty, but also the human capital that exists in North Carolina and the potential of the human capital. It's a very attractive place, which is why so many people are choosing to bring their businesses and their families to North Carolina.
Yeah, you're right. I went to Sunset Beach while coming back. It's an amazing place.
It is.
Right.
Most definitely. Well, if you look at what we talked about earlier, the story of the initial or the first initial influx of Indian physicians was in that 1960s period when the government had recognized that there was an insufficient number of doctors, and for looking internationally for physicians to come to the country. And so I think you see that large influx of Indian physicians primarily for training in the 1960s. And it still continued to be a very attractive place for individuals who have a medical background or want to have a medical background to develop that. The nation is facing a physician shortage. And I know that physician shortage exists in India and other parts of the world as well. So part of, I think, what we're going to need to think about is as we're trying to grow the doctor population here in North Carolina and in other parts of the country, it'll be important that we recognize that there are also physician shortages in other parts of the world. And this is why it is so important to develop more training programs, more medical schools, more educational opportunities. Think about the way that technology, again, can help have the doctor see more patients, for a lack of a better term. But so much of that is really learned through the Indian American physician experience. And as we see today, there are a lot of Indian Americans in medicine contributing in ways that are breakthrough, like we talked about earlier with some of the remarkable technological advances we've seen, but also so many just taking care of so many patients day in and day out, really trying to help people get healthy. Yeah, that's a great question. I never thought of myself in particular entering into a world where I would be doing health policy, at least not when I was in medical school over 25 years ago. But I think that in order to have real impact on healthcare, it is so important to be a healthcare provider if you're a doctor and see patients, but there's also an expertise and there's also a knowledge base you can bring into conversations around things like policy, around things like the business of healthcare. So in many ways, physicians are uniquely qualified to be participating and in some cases leading those conversations because it's the experience of what you see through your own patients, through your own experience that can help inform policy. So in this role, I will oftentimes remember what it was like when I saw patients more regularly and the impact that healthcare had on them and how we might take the good things and bring them into policy, and then find things that aren't working well, and find a way to limit that through policy. So, in my mind, there's a very natural link between what we do in healthcare and health policy, because so much of it is dependent on one another. Yeah, I think first of all, it's a great thing to do. As I mentioned, I would have never seen myself in the role, but I enjoy the opportunity to represent the people in North Carolina, help the people in North Carolina. So my advice is look for those opportunities. Find those areas where you feel you might have knowledge and expertise. Look for those opportunities. Most states are looking for physicians to help share their background, share their knowledge and interest, and particularly if there are policy decisions that the state is considering, lending your clinical expertise is so important. And I know that lawmakers like to see that. They want to see that, just like in any industry, they're going to want individuals who are part of that industry helping inform them. Lawmakers, both at state level, federal level, appreciate it when physicians can offer their clinical expertise as they're thinking about some very complicated issues that are going to have to be rooted in policy. Yeah, most definitely. North Carolina is a leader. It has been a leader for a number of fronts. We're about the 10th largest state in the country, so you're just going to have some leadership that comes with size. But we have been a very innovative state as we think about new ways of doing things. We have never been afraid of trying to do things differently. So North Carolina has consistently been a leader. But we also learn from other states, to be fair. So it's not just what we're doing here in North Carolina. And while there may be 50 or more different ways to run healthcare at a state level, there is quite a bit of coordination that also happens. So we try not to reinvent the wheel. And so it's a balance between learning from others and trying to capitalize on their experience and knowledge, but at the same time being a little bit risk-taking and thinking about what North Carolina could be doing differently. This is a wonderful opportunity. I actually remember India Abroad when it used to be a newspaper, and I remember when it actually used to come into the mailbox again back in the 1970s, 1980s.
Right.
So it's nice to see the progression and it too having modernized as healthcare has modernized.